I'm Paul from Clarity's customer-facing team, and I'm here to talk to you today about our breast cancer consultations. And I'm joined by Pauline, one of our nurses. And Pauline, if you could start by giving us a bit of an overview on you, that'd be great.
Hi, Paul. Yes, certainly. I've been involved in the cancer field for 30 years. I have lots of experience and I've seen lots of improvements over that time.
Brilliant. Lots of experience, which is great. And in terms of our breast cancer consultations, Pauline, can you give us a little bit of an idea, an overview of what to expect in those?
Yes, certainly. It's an opportunity, usually about 30 minutes, for the patient to tell us about their own personal personal history and their family history, to look at any concerns that they may have at the moment, to help advise on breast self-examination, and if appropriate, to signpost to any screening that's available.
Brilliant. And in terms of breast cancer, what sort of lifestyle factors are involved?
Yes, it's actually interesting about lifestyle factors, particularly exercise, because the research is now showing that exercise is a real preventative issue when thinking about cancer. And this is down to the hormones that are produced in the body when people are overweight and not exercising. So by regular exercise, you can really lower your possibility of developing cancer. So exercise is a major one. And exercise is always really important as well for people who've had cancer. If they start exercising afterwards, it reduces their chance of recurrence. So that's really positive. Alcohol. Again, the latest research is showing that really no alcohol. Now, we're not living in that society where we're telling everybody not to drink. So moderation in everything. And the last one is obviously not to smoke.
Wow, okay. And prevention is really, really important. So
Yes.
keeping an eye on these lifestyle factors does have an impact.
Yes.
Brilliant. Okay. And in terms of the incidence rates of breast cancer, can you tell us a little bit about those?
Yes, now I've seen this dramatically change over the years. At one time, it was 1 in 14 women that would develop breast cancer in their lifetime. It's actually down to 1 in 7 women at the moment who will develop breast cancer at some stage in their life. And also there's breast cancer in men, but only 1% of breast cancers tend to be in men. So that incidence is also increasing 1% every year. And in the under 50 age group, it's increasing by 1.4% every year, which is why it's really important to be breast aware and to breast self-examine.
Wow, okay. And in terms of self-examining and our breast cancer consultations, what type of advice and guidance would a patient expect from our consultation?
When we're having the consultations, obviously it's individualized to that person, and depending on their knowledge of self-breast examination, we can work with the person and teach them, talk them through the process in doing the examination.
Brilliant. And finally, how important is it to be proactive and work on those prevention and those lifestyle factors that you talked about?
It's extremely important, as I say, because the screening program in the UK doesn't kick in until the age of 50. So for those women under the age of 50, it is the only method of screening as such at the moment. So it's really important to do breast examination.
Brilliant. Thanks, Pauline. That's been really useful, really insightful, and it really shows how important having one of our breast cancer consultations is. Thank you very much for your time, and thanks for listening.